Hi, everyone. My name is Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you are new here, welcome and make sure you do subscribe. If you are a regular viewer, please also make sure you subscribe if you have not yet already. All of you not only help me, but you also help all the other people finding this important, informative channel, especially more than ever today with our political climate in the United States. We all need to support each other and support our allies, and we need to put more objective, educational, professional information out there. And the most important thing, there's a link below in description box to my Instagram page. Please also go ahead there and support me on Instagram by subscribing if you have not yet already. That's where I put daily tips, advice, guidance, and weekly Q&As where I answer your specific questions on Instagram. So please go ahead and support me on there as well. Today, I want to discuss with you how experiencing gender dysphoria does not automatically equals that you are transgender. It's a big topic to unpack, and it's a big topic to unpack because there is so much misinformation out there. There are a lot of myths floating out there, and the most detrimental, I would say, and the most dangerous piece of misinformation is this: gender dysphoria, if you're experiencing gender dysphoria, equals you are transgender. And if you are transgender, that also equals you have to go through medical and surgical transition, which absolutely is not true. And if anything, what it does is it enforces people to medicalize their bodies when medical and surgical was never their goal. Now, don't get me wrong, medical and surgical transition is without a shred of a doubt a life-saving, gender-affirming intervention for people who not only have gender dysphoria stemming from gender identity core issue, but people who need it to alleviate distress and who want it, and for whom that is part of their transition goals. But sadly, today, we do have people who did transitioning, and they're detransitioning because gender identity was never, ever a root cause. And I will talk about it a little bit more in detail here, and I will help you all understand it. Now, first of all, let's clarify what is transgender identity. Transgender identity today is a very large and a very wide umbrella term. It's really more like a tent than umbrella, really. It covers that much of a ground. And underneath this umbrella slash tent, we have all individuals of all different types of gender identities who, more or less, one way or another, do not resonate, do not align, do not feel comfortable with very strong societal, cultural ideas of the binaries of gender presentations, such as man, woman, masculine, feminine. So, underneath this umbrella, what you need to first realize is that we have individuals who not only um, consider themselves to be trans-identified, either trans-masculine, trans-feminine, trans-woman, trans-man, but also non-binary people, as well as gender-queer, as well as gender-diverse, as well as people of all other gender identities, as well as individuals who strongly don't resonate at all with strong societal norms. Today, the language, the labels by which we all try and aim to clarify and define how we feel in regards to our gender keeps growing and keeps expanding. And as a result, that's why transgender is no longer an umbrella term. It is this huge, huge tent. Now, some of you may argue that that's not a good thing. Some of you may argue that's a good thing. It's very inclusive of everybody and anybody. We all have our opinions on the subject matter. But by being such a huge, huge tent that covers anybody pretty much who is gender bending, if you will. As a result, we have individuals underneath this umbrella who severely struggle with gender dysphoria. We have individuals who have a very mild gender dysphoria. We have individuals who have absolutely no gender dysphoria. That's right. And we have individuals who have only experienced gender euphoria. And that creates um, it creates a challenge, I would say, for providers who aimed at helping people who come into our offices and seeking clarity, clarification, support, and guidance. And unfortunately, a lot of providers are misinformed or not experienced enough in a gender field. And they also perpetuate the myth, oh, you came into my office, you express your symptoms, you check the checklist in DSM for gender dysphoria. Guess what? That means you're transgender. Oh, and you know what? Currently, the accepted treatment for gender dysphoria is transition. So it's going to be social, legal, and it's going to be medical and surgical for you. Again, there's no one size fits all. The reason why is because all of you are not only experiencing gender dysphoria drastically different from each other, also your life circumstances, your current access to resources, and your overall environment is going to dictate what you can do and what your goals are. It's also going to dictate what your personal desires are in regards to how you see yourself. On top of that, this is very important. Not all of you experiencing gender dysphoria as the primary root cause. Now, let me clarify. Let me peel a little bit back so I don't get anybody confused and clarify first. Now, I clarified transgender identity, right? That it's really this huge net. And one thing that I want all of you to realize is that underneath this net, we do have people with dysphoria, but we also have people that have no dysphoria. We also have people who have only euphoria. Now, what the heck is gender dysphoria? Because that's the word that is being thrown around a lot. That's the word that became very synonymous with gender identity and very synonymous with transgender. Gender dysphoria, all it is it's first of all, it is not a gender identity. It is simply a psychological distress. It's a cluster of symptomatic distress that together when they're all together combined, they create enough tension in an individual between their gender assigned at birth and between how they currently feel. But here's the most important thing. Even though in DSM, when you read the criteria for gender dysphoria, it may sound like it has everything to do with gender identity, right? How can it not? When it says you must desire to get rid of yourself of secondary sex characteristics, uh, to align yourself with the opposite ones, with the opposite sex. You must have symptoms where you want to be perceived in gender other than your gender assigned at birth. So it's all hints on ideas that gender dysphoria does equal gender identity issue. But here's the thing. Again, gender dysphoria in a particular moment for a particular individual is a symptomatic distress. Here's the most important thing that every clinician needs to be talking about and shouting about. But the most important thing is that what is the root cause? What is causing anybody to experience gender dysphoria? Because here's a newsflash: cisgender people also can and do periodically experience transient states of dysphoria that can last for a shorter or longer duration of time and has nothing to do with our core issue being gender identity. Why? Because, well, culturally, we have very strict binary views on everything. And eventually, some people just feel like it's very suffocating. And as a result, they start experiencing societal distress. As a result, they start feeling and experiencing gender dysphoria. Here's the thing: people can, on the surface, have symptoms of gender dysphoria, but there are root issue, the roots that are causing you to feel gender dysphoria for some people can be severe sexual trauma. Sexual traumas are, um, first of all, it's a violation on our relationship to our bodies. It is a violation on our sexuality. And because it's so closely tied to our bodies, people too that develop very severe trauma wounds from sexual traumas, where particular body parts can be so incredibly triggering to the point where a person wants to get themselves rid of those body parts. Now, that's very different than having a core issue being gender identity, where it's not necessarily that you want to get rid yourself of the body parts because of any kind of trauma, but because you just from the get-go don't feel aligned to your gender assigned at birth. Do you follow me? Also, people can have gender dysphoria from any type of abuse that is potentially severe enough and potentially may have to do with multi layers of gender presentations, multi layers of how you navigate the world. People can have an experience and do experience gender dysphoria when they having body issues, which is an service body dysmorphia and a very different things. People can and do have symptoms of gender dysphoria when, for example, they're so bombarded by strong, again, societal norms, or when they are just trying to explore and they want to navigate and present themselves differently while feeling comfortable with their gender assigned at birth, but they're getting a lot of social pushback, and as a result, they develop socially infused dysphoria. What I'm trying to say is this: there are also, without a doubt, a lot of people who have gender dysphoria that stems the root issue. If I were, imagine you as a person is a tree, and your dysphoria is coming from underneath the soil. If I were to lift up and look underneath your roots and to see what's happening, for a lot of people, the reason why you are experiencing gender dysphoria is because the core issue, the fundamental core issue, is gender identity, period. And those are individuals who, by far and large, in my experience, benefit the most from gender affirming interventions. Now, does it mean that people who experience gender dysphoria from, for example, severe sexual abuse should not get gender affirming intervention? That's the way that I would like to look at it is, well, what is the core issue? If the core issue is actually sexual trauma, would addressing sexual trauma alleviate the dysphoria? Because again, here's why there's people who do detransition. A lot of individuals do report that they had history of some kind of trauma, abuse that was never addressed and was never brought up. And as a result, they started to question their sense of identity, but the root issue was never gender identity to begin with. It was something else. This is why, for anybody and for any of you working with any clinician, to always analyze what is the root issue. And to complicate it even more, again, this is how nuanced and how complex dysphoria is. Dysphoria as a root issue can stem from childhood, which is called early onset gender dysphoria, and it can also have an onset later in teenage years, or it can have an onset later in adulthood. So assessing all of that is going to be really, really important. But I hope now you can see how having gender dysphoria doesn't automatically equals and should never, ever be taken as automatically equating that to trans identity. What we should be doing, and anybody who is watching this right now, who's still questioning if you're transgender, what you need to be doing is, if you're not working with a professional, what you need to be doing is asking and trying to see, well, what is the root issue? What is the root cause? Why do I feel currently, in some shape or form, not comfortable with some elements of my gender assigned at birth? What is happening? When did it start? What may have been root issue? Again, for a lot of you watching, it's like, um, I've seen this so many times. It's a slam dunk, right? A lot of you can just say, "Hey, age 4 or 5 period, I always knew. I never felt comfortable in my gender assigned at birth, and it has been consistent and persistent throughout my lifetime." there you go. It's very clear in those cases that the root cause is gender identity. It becomes less clear in cases where individual is suddenly one day has gender dysphoria, and that's where the examination warrants. Again, does that mean that a person should not identify as trans? You have to understand that today, transgender identity, again, is not necessarily um, subject to a person having or not having dysphoria. Believe it or not, there's a lot of individuals who tell me and share with me that they actually feel comfortable with their gender assigned at birth, but by either feminizing or masculinizing, they also felt equally comfortable presenting another gender. And with some time as it passed, they actually felt more like themselves being particular gender versus their gender assigned at birth. So this is more, I would say this is more oftentimes we see in gender fluid individuals, but sometimes people who are fluid over time do make a decision that, you know what, even though I can live in my gender assigned at birth, I prefer navigating my life in a different gender or as representing different gender. Whether and we can again do this such a big debate. It's not for me, not my subject matter to debate whether they should go through transition or not. What I care about is alleviating pain and distress, any kind of and pain and distress, and alleviating it in the best way possible with things that are accessible to you in order to bring that pain and suffering down, and most importantly to also not do things so drastically or so quickly, where then people for whom gender identity was never a core issue, then they feel like, oh shoot, this is really not how I'm feeling. So now I hope you really understand how gender having dysphoria, again, cis people have dysphoria. Does it mean they're trans? Not necessarily. Transgender is an identity that can and does exist outside of gender dysphoria. People with gender dysphoria for whom gender identity is a core issue go on identifying as transgender because they don't feel comfortable with their gender assigned at birth. But again, having gender dysphoria in no way automatically equates being trans, and most importantly, in no way equates medical and surgical interventions. Hopefully this was helpful. I will do a video also discussing much deeper different rooted causes of gender dysphoria. Recently, there's a presentation on this at the university because the root causes, as you will see, is multitude. Now, if your root cause is something other than core identity, or let's say your root cause is let's say it's a combination of the factors for you. Again, does it mean that you should not, if you want to decide to transition, that is also very debatable. That is up for you to decide. I'm dealing with adults. My goal is to present you with enough information for you to have at the table where you consider all the pros and cons and make the best decision for yourself. For me, it's not to outline criteria who should and should not have access to care, but it is to clarify that what we're talking about today as gender dysphoria equals trans is deeply inaccurate, and we really need to start looking at gender dysphoria in a more nuanced way. We need to acknowledge that there are many root causes, and not all root causes lead to the same issue. Comment below, let me know what your thoughts are. Hopefully this was helpful, and I will see you all next time. Goodbye.